Hello and welcome to one and all. I welcome you all to yet another episode on breast cancer awareness. The Breast Cancer Awareness Series, an initiative of Integrated Health and Wellbeing Council and Rapid Global Cancer Alliance, being supported by Roche. So, this topic of discussion that we are gathered today is on breast cancer myths and facts. And to bust all these myths and facts around breast cancer, we have a very eminent panelist here with us today. I welcome Dr. Sreevalli A, who is consultant medical oncologist with Sri Shankara Cancer Hospital, Bangalore. Ma'am, welcome to the show. We are so glad to have you with us.
Thank you.
This is the third episode of the Spotlight series on breast cancer awareness, and we tackle a very critical topic: breast cancer myths and facts. In a society like ours, where women health, specifically the reproductive health, has been stigmatized, it is very important for us to gather for this breast cancer awareness month that we are in, and also take this opportunity to spread awareness on the facts that are the true facts around breast cancer, so that people do not believe the myths to be true. People are reluctant usually to talk about these issues, which often lead to misinformation, unnecessary anxiety, and also myths all around breast health. So let us dispel these. My first question to our specialist here today is, what are some of the common myths or misconceptions that you see your patients come up to you with, or people have around breast cancer?
So I thank you for the warm welcome. So there are several misconceptions pertaining to breast cancer. So let us see them. One of the commonest misconception is that, only women are at risk for breast cancer. So however, the reality is men are not immune to, even they too can get breast cancer. Then having no family history in that particular family doesn't put you at a risk for breast cancer is what people think. But the reality is we see a significant proportion of breast cancer patients without family history. There are several other risk factors too, which can cause, breast cancer. The other thing is they think that any lump in the breast is cancerous. There are several lumps which are benign, which are non-cancerous too. So that should be known. And the older women are at risk for breast cancer is another misconception. So they think that I'm younger, so I may not develop breast cancer per se, but this is not the reality. And usually the breast cancer lumps, what we see are painless. So people think, oh, I've got a painful lump. Maybe this is cancerous. Bigger breasts and wearing, underwire bras put them at risk for breast cancer, but this is not the reality. Screening mammogram, which are done, people think that per se can cause breast cancer. Whereas the reality is we see that hardly around 0.4 millisievert exposure to the radiation per se by the screening mammogram. In fact, it helps us in detecting the breast cancer early, even in those who do not have a lump per se. So biopsy is another, misconception related to that. People think it causes upstaging. It causes seeding of the cancerous cells, but that is not the reality. The fact is that it helps us to know what is the histology, the biology of the disease, and to plan treatment. So using antiperspirants, the day-to-day, what they use, the deodorants, perspirants, antiperspirants, so they can cause breast cancer per se, but there is definitive evidence now that no, it does not. Does breast implant increase the breast cancer? No, that is also a myth. So it is very important for us to differentiate, between myths and facts by understanding the correct information.
Thank you so much, ma'am, for sharing these varied myths. One by one, we will dive into detail and understand from you all these. We would also talk about a few different myths later on in the discussion, if those are not covered, by us already. So regarding the misinformation that, only women can get breast cancer. Can you please talk a little more about this? As not only, women, but also we are trying to reach out to a larger population with our show today. And most of the people, I believe, do not know that men can also suffer from breast cancer. So over to you.
So being a woman definitely puts us at risk for breast cancer, but the breast cancer per se is not limited to women. So it can happen in men too. Women are at 100 times more risk than men in getting breast cancer. But if we look at the overall male breast cancer, it accounts to almost 1% of all the breast cancers too. The other important thing is in men, because of lack of awareness, what happens is they do not pay attention to any such kind of a lump, and they do not assume, oh, okay, it can be cancerous too. So this results in delayed diagnosis, hence delayed treatment. So we see a higher amount of mortality in men. So definitely everyone needs to be aware that it can equally be seen in men too.
Thank you so much, ma'am. Let us move on to another very crucial point that needs to be discussed. The myth that having no family history means you are not at a risk for breast cancer. Because people understand that if your mother or any aunt is suffering, or any female in your family have been suffering from any breast cancer, then there are more chances for you to develop. But they feel that if none of my family members ever suffered, so there is no chance of me of getting breast cancer. This is simply just tumor that can be ignored. So can you please help us enlighten?
So family history, if we look into as a risk factor for breast cancer per se, it accounts to only 10 to 15%. So the rest 85 to 90% are somatic causes, that is the acquired condition. And also when we look into the family history, there are several genes which can be associated with breast cancer. Like we mainly say about BRCA genes, BRCA1 and BRCA2 genes, which are seen, because knowing these particular genes present or absent in the family helps us to plan treatment, plus guide about the prophylactic measures which can be taken by the family members too, not only the patient, the members too. So like I mentioned, 85% of the cancers, the major chunk is not because of family, it is because of acquired condition. So what are these acquired conditions? So one I mentioned is age. So being elderly puts you at a risk factor for breast cancer. But we do see breast cancer even in younger, we have an 18-year-old with breast cancer. So it is not the total age criteria per se, but the higher the age, the chances of breast cancer increases. So not only age, like I mentioned prior, being a woman puts you at a risk. Then not childbearing, the modern mentality, they do not want to have a child. Then not breastfeeding, taking hormone replacement pills, early menarche, late menopause, obesity. These are certain other risk factors. In fact, the major important risk factors for breast cancer. So it's not only the family history, they should be aware about it, but 85 to 90%, there are several other factors.
Thank you so much, ma'am, for helping us understand that in such a nice detail. There is also another running myth, not just with breast cancer, but with other cancers as well, that if you were to go get tested, or if there is any biopsy taken of the tissue, that it will lead to spreading of the cancer to unnecessary areas. And people have this myth that, no, I don't want this tumor to spread and become cancer later on. That is why I'm not only going to get checked. So the belief around benign or malignant, can you please highlight the difference between malignant and benign cyst, and also bust the myth, or just help us clarify everything around this point?
So not every lump is cancerous, Having a lump doesn't make it, that, okay, I've got a cancer per se. So this is what each and everyone should understand. So there are several lumps in the breast which can be benign. A majority are actually non-cancerous. So especially the younger women, they come up, they're very much anxious that they find a lump and they think, okay, it's a cancer. So it depends on what is the consistency of that particular lump there. What is the variety? Is it soft, cystic, firm? How are its surfaces? And how are the edges? And is it associated with any changes in the skin? Is there any other lump in the axilla? So all this is taken into consideration and then decided, is it a benign or malignant? Because most commonly in these young women, we see fibroadenomas of the breast, which we call as a mouse in the breast, which is very common. Then we see fibroadenosis. The size usually, increases during periods. Patients complain that they have got pain only in that menses period. And in lactating women, we see galactosele. Several cysts are present in the breast. So they're usually very cystic in consistency. They're very soft and they disappear themselves. So the key point is, when an individual finds that there is an unusual or there is a new onset lump in the breast, get it evaluated by the healthcare provider. So the physician, he or she should examine, and they should tell them that, okay, this is a benign, not to worry. You can just be on follow-up. Or is it malignant? You need further evaluation. So taking the oncologist opinion or a healthcare physician, anybody may be on the first visit to decide on, is it a benign or malignant, is very important. And like you mentioned, the investigations which we do, like mammogram, they're usually preferred in those who are more than 45 years of age. In the younger ones, we usually prefer ultrasound. So none of these imaging modalities increase the risk of breast cancer, which the individual should understand. Okay, the annual investigation of an annual mammogram, will it increase the chances of he or she getting breast cancer? No, definitely not. And we start doing it in those individuals, especially with a family history, 10 years prior to the onset of, the breast cancer per se in the family. Or we, in fact, advise every woman more than 20 years of age to do breast self-examination, detect it at the early and get the evaluation done. So whenever we find that, this particular lump, okay, may be cancerous, so we give something called as BIRADS in the mammogram, which tells us the gravity of that particular tumor and assess it. Okay, it may be more malignant. It needs an evaluation further. So we advise for an FNAC or a biopsy. Mainly we want a biopsy, and biopsy doesn't increase the chances of seeding of the tumor or upstaging. So we get to know the histopathology. Is it an in situ? Is it an invasive tumor? And how do we manage it? We also get the hormone status, like the estrogen, progesterone status, the grade of the tumor, the Ki-67. So based on which we need to tailor, okay, this patient goes for surgery first. This patient goes for chemotherapy first. Or, okay, it's just an in situ, nothing to be done, just a surgery, and keep the patient on follow-up. So all these things are very important, and definitely one should not get scared to do a breast biopsy when advised by an oncologist, because it gives us more information in planning the treatment.
Thank you so much, ma'am, for so nicely explaining us all these points, dispelling the myths around benign and malignant tumors and the different methods for testing that are available. So, ma'am, as we were discussing the same, along the lines you mentioned that, there is the younger women that generally get scared whenever they find any sort of lump in their breast and get really scared. So there is another very big running myth that goes around that if you catch, if you are detected with a breast cancer, the surgery would involve removing your breast. So many women are in this myth that that is the only treatment option that is available, and you would be advised to go through that kind of surgery, and that would also hamper the quality of life that they would have post recovering from cancer. So can we please talk a little bit about that, the different methods of treatment that are available in advanced, oncology, as well as talk about the importance of detecting the cancer as early as possible.
So yes, there are varieties of treatment that are available, because now there is a lot of development and advances, in the methodologies and how do we treat a breast cancer. So we have clear-cut guidelines, and the treatment mainly depends upon what is the histology, what is the stage of the disease. Is it stage 1, stage 2, stage 3, or stage 4, which is given by AJCC? Is the tumor restricted to the breast, or has it involved the node, or has it gone to the other areas also? Has it become a stage 4? So that becomes very important for us. Along with that, the biology of the disease. In breast, we have got 3 varieties. So is it a hormone positive, or is it a HER2 positive, triple positive, or is it a triple negative breast? So in deciding on to which treatment the patient goes first, breast. So these are the tumor characteristics. Along with that, we need to look into the patient characteristics, because my patient has to be fit to take the treatment. So a very elderly patient, I cannot jump and give a stronger chemotherapy or plan for an advanced treatment. So need to look into that too. So what is the performance status of the patient? Is he or she able to do her daily activities? Has she got certain other problems like diabetes, hypertension, a cardiac problem? And is the treatment feasible? Is the patient affording to that particular treatment? Because half treatment is dangerous too. So all these three things need to be taken and tailored. And when we come to the early stage breast, so a smaller tumor, so we have got surgery in upfront setting. So what kind of surgery? Yes, definitely people are scared that, the whole breast will be removed. So we have got something called as breast conservation surgery, wherein only that particular lump is removed. For smaller tumors, for those, node negative, don't have another lump in the armpit, in those kind of individuals, there is only that particular lump is removed. So that is called as breast conservation surgery. The other one is the whole part of the breast as well as the armpit swelling, that is the lymph nodes are removed. Even in the lymph nodes now, there is a lot of developments. There is something called as sentinel lymph node biopsy, wherein the surgeon injects a dye around the breast and looks into the first node which catches this particular dye. That is examined under frozen, and they see, okay, if this is not involved, need not remove any node from the armpit area. Or if it is involved, then only they proceed in removing the nodal area in the armpit, because people are worried about the lymphedema, the limb swelling that happens post removal. And even in those, when the breast is removed because of the larger tumor or the bigger tumor, people need not get worried, because there are reconstruction techniques now available. A flap is taken and a normal breast, can be made and again, put in there. So we have our plastic surgeons who play a major role. So women need not be worried about appearance, cosmetic. So that is about surgery. So based on, is the tumor too big or is there any nodal involvement, there's something called chemotherapy, wherein we give medications intravenously. And for bigger tumors, those node positive, there is a need for radiation too. So chemotherapy is usually followed by radiation. And then based on the biology, if they are hormone positive, they will get the hormonal treatment for a total of 5 to 7 years. Now we have even data for 10 years. And targeted therapy, trastuzumab, based on HER2 positivity. And those who have got a very advanced disease, who are not fit for surgery in the upfront setting, so we give them chemo to shrink the tumor. So that is there still possibility of breast conservation in them. So we give chemotherapy followed by surgery, then complete the rest of the cycles if remaining, followed by radiation and then other therapy based on hormone or HER2 positivity. This neoadjuvant chemotherapy, which is given prior to surgery, also helps us to tailor what we should give post-surgery based on the histopathology specimen we see post-surgery, because we want there to be no tumor in that particular specimen when we would have given chemo, shrunken the tumor, and then the surgery is done. So women need not be scared about the treatment. People think, hair fall is the most common myth associated, and they think that, okay, chemo, everything is over. That's the biggest myth. It's painful. It'll make my life hell. People need not think so, because there's a lot of development. The hair fall too is a temporary. It'll come back once the chemo sessions are over. And the entire process is done in a smooth way by giving medicines to prevent vomiting, to prevent them from having loose stools, the fatigue which they have. So we have our psycho-oncologists too to support them. We have wigs available. Then we have, breast supportive care available. So all those things are there, and there's several developments. So women need not be scared. They need to speak to the survivors, boost themselves, and, take the treatment and fight the disease.
Thank you so much, ma'am, for listing out all these, treatment options that are available, and with the advancement in medicine and surgery, as you shared, the amazing techniques that are available now to, give as much care to people suffering from such condition as possible. With that, another very big point that we wanted to cover or bring across is the importance of awareness that you and me are doing through this platform today, as well as encouraging people to get screened regularly or at an early stage if they find any signs or any abnormal lumps, that as you suggested, or if they have any family history. So, ma'am, what would be the screening, protocols that you recommend to your patients or people that you know, and that you would like to share with the audience?
So screening refers to detecting the presence of cancer in those who do not have any symptom. So what is it is they don't have a lump. They just want to know if they have got cancer or not. So especially in those individuals. So it is usually done by three modalities. One is self-breast examination. So which is very important. So we teach every woman who is more than 20 or, prior to 10 years of the onset of the cancer in their family to do a self-breast examination. It should be done usually around 5 to 7 days post their periods and monthly on the same day. So every month they need to examine by standing in front of the mirror. There are three main tips, that is look, feel and squeeze. So they need to look into the mirror, the level of the nipple, presence of any unevenness in the breast or presence of any lump, any armpit swelling, any changes in the skin. Then what do they feel? With the flat of these 3 to 4 fingers. So with this flat, they need to palpate every quadrant of the breast, and it is usually done in a circular motion. It shouldn't be squeezed or held like this because the breast has two main parts, that is the fatty stroma and the lobules or the milk producing gland. So that particular thing will feel like a mass, otherwise every woman will come up and result in unnecessary investigation. So should be felt with the flat of the fingertips, and all quadrants need to be palpated and looked for any unevenness, any lump they feel, and then visit the clinician accordingly. Then squeeze is to squeeze the nipple to look for the presence of any discharges there or not. So once this is done, there is clinical breast examination. So they need to visit their clinician, oncologist, get it examined. So suppose there is a family history and there is this genetics I mentioned, BRCA1 and BRCA2. If positive, annual examination of breast is very, very important. So yearly it should be examined, and or if the individual feels a lump, go and visit immediately. Don't wait till a year. So one is examination. Secondly, a mammogram. So we need an investigation too. So annual mammograms are advocated in all women more than 40 to 45 years of age. In the younger ones, we prefer ultrasound because the breast is very dense in them, unlike, those who are elderly. So after this, any abnormal lump felt need to be biopsied. So the screening technique, it's mainly self-breast examination, clinical breast examination, and a mammogram. So it's very important to know. And as October is Breast Cancer Awareness Month, I think every woman should know and spread it, to their family members, mother, sisters, those who have got children, to their daughters, and housemaids who come to clean. Everyone should know about it because the early diagnosis is the only key to complete treatment and cure. So breast cancer is one which can be cured. So definitely screening is very important.
Thank you so much, ma'am, for informing us on these things. Are there any specific ages that you would recommend to surely get your proper medical screening done for breast cancer? Are there any specific stages or ages in a woman's life that she should come and just precautionary get checked, as we are seeing the rise in the number of breast cancer in past few years, a decade or so? So are there any recommendations around that?
Yes, definitely. Like I mentioned prior to, anybody who's more than 20. So any women more than 20 needs to examine their breasts themselves, clinical breast examination. Self-breast examination, and clinically 10 years prior to the onset of the breast cancer in their family, if there is a family history, because women until 40 years, they would not pay much attention to themselves because they'll also be working. And when they said, okay, annual checkups start from 40 to 45, that is when they start getting their annual mammograms done. So we don't advocate an ultrasound every year for all women from 20. self-breast examination is more than enough unless there is a strong family history. Otherwise, all women more than 40 should definitely undergo a mammogram as a part of their general checkup.
Thank you so much, ma'am. There is also a few quick things that we would like you to highlight. As initially you highlighted that many women believe that wearing underwired bras leads to higher chances in breast cancer. One being that, another one being that any injury to the breast surface can lead to a breast cancer. This is also a running myth. Another running myth is that women who are not do not get married all their life tend to develop breast cancer more than women who get married and bear children and breastfeed. So can you please touch upon these three aspects as well? Also about breast implants, as you touched initially, can we understand a little more very quickly on these areas as well?
So yes, so now there are several varieties of bras which are available. So definitely these push-up bras or the underwired bras, they do not cause breast cancer. Initially, it was thought that, wearing them, there will be a blockade in the lymphatic drainage. So causes a clog-like feeling and hence it enhances the chances of getting breast cancer. But there's definitive evidence now that it does not. It's a myth. Then also any injury to the breast, there can be something called as traumatic fat necrosis or, per se the injury will not cause any cancer. Maybe I would say that particular injury brings to the notice of another swelling or another lump in the breast which was pre-existing and the individual got to know, okay, now it's there. So it's usually that way. Any trauma will not cause cancer per se. It may definitely trigger very later. It's not that, okay, I had an injury today and then there is a cancer there today. It's not that way. Then what else did you ask? I think the other two.
Breast implants.
Breast implants, yes. So breast implants also, there was a myth that, putting in a silicone implant in the breast causes breast cancer. Definitely no. There has been definitive evidence now, several studies done, that the implants are mainly to get back the cosmetics and the appearance of the breast back per se. And there is no chance of breast cancer because of that.
Ma'am, another running myth is women who do not get married, do not breastfeed, do not...
Nulliparity has got high risk for breast cancer. The reason being the prolonged estrogen exposure. So higher the estrogen exposure in a woman, like, early menarche, those who become, those who start menstruating less than 12 years of age, or late menopause, later onset of menopause, or those who don't get married, those who don't childbear, because there are several changes which happen in the cells of the breast. The ductal and the lobular part of the breast is lined by several cells. So there are changes which undergo normally. So there is no progesterone exposure in these women. So definitely breastfeeding is very important because it results in high progesterone and lesser estrogen exposure. Estrogen is a risk factor for breast cancer. So every woman should know that they need to have child, which is the normal process, and they have to breastfeed. So lactation should be practiced by every woman.
Thank you so much, ma'am, for clearing all these various myths that we discussed today. Also, we would like to discuss on two different aspects before we end this discussion, is the importance of spreading awareness, and the importance of spreading awareness not just amongst the patients, the women, but also amongst the medical fraternity. As women feel very comfortable, and gynecologists are the first people where they reach out to for any issues regarding breast lumps or any other things that they are feeling. So the importance of awareness around breast cancer, not just amongst lay people, but also amongst gynecologists. So can you please touch upon that? What is the role of awareness in dispelling myths and also bringing a community in India that is more aware towards their health?
So awareness is paramount. So it ensures that, right information reaches people, which help them for timely screening, early diagnosis, and getting early treatment. Because myths are very dangerous. It creates an unnecessary panic, and it deters the patient, the individual per se, from going and reaching out to their physicians and taking treatment. So disseminating this kind of awareness, by these awareness programs can save lives. I would say that it's definitely a very good modality by which we enlighten people, get them aware about, okay, such a thing exists, and the stigma per se should be out. They should not feel ashamed to discuss such things. So it helps save lives. Definitely among medical fraternity too. So when they reach out to whosoever they are close to, their family physicians, gynecologists, the primary healthcare providers. So what happens in them too? They also become more aware, and they get to know that, okay, they need to refer them to further oncologists like surgical oncologist, medical oncologist, radiation oncologist. All of them play a major role. So referring them to the Oncospecialty Institute becomes of prime importance, because there's something called as tumor board meets, which happen as a whole spectrum. The disease is taken into and the treatment is planned. So it's of utmost importance to spread awareness. And I would just like to end by a small, a saying that life is just not about waiting for the storm to pass. It's about, learning to dance in rain. So I would say, be strong, be brave. We do not know, whom you are inspiring.
Thank you so much, ma'am. That was such a beautiful line that you portrayed. And definitely it would serve as a key takeaway message for all the viewers that are watching. If there is any other message as well that you would like to add along with this for our audience.
I would say, be strong, be brave. Don't get disheartened. We are all there to fight breast cancer.
Thank you so much, ma'am. With that, we come to the end of a very interesting session today. We dispelled a whole lot of myths on breast cancer, and also, taking the advantage of Breast Cancer Awareness Month that is going on. We thank you for taking out time from your busy schedule and imparting a wealth of knowledge and information here with us today. So thank you so much, ma'am. Dr. Sreevalli A, Consultant Medical Oncologist with Sri Shankara Cancer Hospital, Bangalore. Thank you so much. We would also like to thank our partner in this mission, Roche, for this brilliant initiative of spreading awareness around breast cancer through the Breast Cancer Awareness Series. Thank you so much. We would also like to thank all our audience for staying with us till the very end. Please stay for further episodes that will be coming along every day to spread awareness around different topics all around breast cancer. Thank you so much. With that, we sign off now. Stay happy, stay healthy. Thank you.